You'll help him carry out that review, that safety review.
Absolutely.
And this study that is out just this last week just underscores the need for ongoing safety review and for a look, I think a fresh look at all the data. Would you agree with that?
It does look that way.
Yeah, and would you also agree that it's time for the FDA, as part of that thorough top-to-bottom review, to think about reinstating the other long-standing safety protocols on this drug? Until the Biden administration eliminated them, mifepristone for 20-plus years had always required physician dispensing, in-person dispensing, physician follow-up visits. The Biden administration eliminated all of those things. Now telehealth providers, you don't even have to be in this country now to send this drug, to prescribe it, quote unquote. You don't have to be a doctor. You don't have to see your patient. You don't have to be in America. You can mail it into states regardless of state law, what state law is. And this is one of the reasons we're seeing such incredibly high adverse health events. Don't you think it's time to reconsider and to revisit putting back in place those longstanding safety protocols?
Today on Hot News Today, fireworks erupted in the Senate as Senator Josh Hawley pressed RFK Jr.'s deputy nominee for Health and Human Services on one of the most controversial issues in America: chemical abortion drugs.
Mr. O'Neill, nice to see you. I enjoyed our conversation, our visit the other day. Let me just start with this. You're familiar, I think, with the recent insurance claim study regarding mifepristone. Is that correct?
Yes, Senator. I've not read the study, but
This is a study of 865,727 prescribed mifepristone abortions, chemical abortions, between 2017 and 2023. It's the largest such study of mifepristone ever conducted, the only major study conducted now in years. And as I think you know, the results were really quite startling. They showed that 10.93% of women who use the chemical abortion drug experience a major serious adverse health event, like sepsis, infection, hemorrhaging, often necessitating emergency room visits, often leading to life-threatening situations. The real dramatic result of this, I think the takeaway of this is that this is a much, much higher rate of serious adverse health events than what the FDA currently reports, 22 times higher than what the FDA has currently reported. So my question is, in light of this new data, and it's an enormous data set, just an enormous data set, isn't it time for the FDA, number one, to put back in place the reporting requirements of serious adverse health events? As you know, in 2016, the FDA eliminated, at the behest of the Obama administration, eliminated the requirement that physicians and others report non-life-threatening but yet serious adverse health events. Shouldn't we put those back in place in light of this data?
Senator, FDA has a responsibility to ensure that all drugs are safe and effective. And sometimes new data comes in and it needs a review. Mifepristone actually has a REMS, meaning it's been designated for a long time as something that needs periodic review of safety data. The Secretary has pledged to do a safety review of mifepristone, and I strongly support that review.
Good.
In a tense exchange, Hawley demanded answers about shocking new safety data, and what happened next could change how the FDA handles these drugs going forward. Hawley pointed to a study reviewing over 865,000 chemical abortions between 2017 and 2023. The results? Nearly 11% of women experience major health complications, sepsis, hemorrhaging, or emergency room visits. According to Hawley, this rate is 22 times higher than what the FDA currently reports. He asked, shouldn't reporting requirements on these serious adverse events be restored? The nominee, Mr. O'Neill, acknowledged the FDA's responsibility to review new safety data and pledged support for a full-scale safety review of chemical abortion drugs.
You'll help him carry out that review, that safety review.
Absolutely.
And this study that is out just this last week just underscores the need for ongoing safety review and for a look, I think a fresh look at all the data. Would you agree with that?
It does look that way.
Yeah, and would you also agree that it's time for the FDA, as part of that thorough top-to-bottom review, to think about reinstating the other long-standing safety protocols on this drug? Until the Biden administration eliminated them, mifepristone for 20-plus years had always required physician dispensing, in-person dispensing, physician follow-up visits. The Biden administration eliminated all of those things. Now telehealth providers, you don't even have to be in this country now to send this drug, to prescribe it, quote unquote. You don't have to be a doctor. You don't have to see your patient. You don't have to be in America. You can mail it into states regardless of state law, what state law is. And this is one of the reasons we're seeing such incredibly high adverse health events. Don't you think it's time to reconsider and to revisit putting back in place those longstanding safety protocols?
Senator, a lot of patients have a lot of trouble getting prescriptions filled across state lines, even medicines that have much less safety concerns than this drug. And of course, every approval that FDA does or reviews can state the appropriate and inappropriate ways of prescribing or dispensing a drug. And so that all of that should be subject to review, absolutely.
Okay, good. All of it's subject to review. The Secretary was very clear on this, that he will conduct a full-scale safety review. He's required to by law, as you pointed out. But I think what this latest study shows is that the information that is coming into HHS, it's time that you took a serious look at the scope of that information, because again, the FDA in 2016 eliminated the requirement to report much of this. This is why this study is so significant.
Hawley pressed if the review would consider reinstating safety protocols like in-person physician dispensing and follow-up visits. The nominee signaled openness to bringing these protections back.
Because it looks at all insurance claims, 865,000 of them between 2017 and 2023. So just to be clear, your commitment is you will do a safety review, you will look at this top to bottom, you will take this data into account. Do I have that right?
I believe the Secretary is already committed to that, and I will promise you to fully support that.
Good. Okay. Let me ask you about your work on conscience protections in an earlier administration. I think in one of the Bush administrations, the Bush 43 administrations, you worked on conscience protection rules for healthcare providers. Do I have that correct?
Yes, that's correct, Senator.
Would you support reinstating and fully implementing conscience protections for healthcare providers?
That would be up to the Secretary and the President, but if they decide to go in that direction, I would know exactly how to do it.
Would you advise them to do so?
I believe I already have, Senator.
Good. And that should be easy, because the Secretary, when he sat right where you were sitting, said unequivocally that he supported conscience protections, that he would put them back into place. The President said he supports conscience protections. In fact, the President had them in place in his first administration. So I'm glad to hear that. We'll hold you to that. Let me talk to you for just a second here. Well, actually, all right, Mr. Chairman, I see I'm out of time, and I'm always so good about obeying my time limits, aren't I, Senator Kane? I'll have a few. That's a joke. I'll have a few more questions for you for the record, Mr. O'Neill.
Thank you,
Mr. Chairman.
What do you think? Should the FDA restore strict safeguards on chemical abortion drugs, or should access remain as it is? Drop your thoughts in the comments below, and don't forget to subscribe for more breaking updates from Hot News Today. Hawley emphasized that because reporting requirements were loosened, federal data is missing many serious cases. That's why this independent review is such a bombshell, capturing the full scope of health outcomes. O'Neill confirmed the department would incorporate all available information in their analysis. Hawley also pressed for reinstating conscience protections for healthcare workers. O'Neill said he had advised leaders in favor of restoring those protections. As the hearing wrapped up, Hawley made it clear he would hold the nominee accountable for following through on these promises. With nearly 1 million cases under review and the FDA's credibility on the line, the decisions that follow could reshape how America handles one of the most polarizing issues of our time. Thanks for watching Hot News Today. Don't forget to subscribe for daily updates. Stay informed and stay engaged.